Hey, Kyle Colbert here, and I'm here with my dad, Dr. Don Colbert. Now, today, Dad, we're going to talk about debunking the Keto Zone myths. Dad, what kind of myths are out there?
Well, the biggest myth, people say, I can't. It's always, I can't do the keto zone because my doctor says ketoacidosis is dangerous. Well, first of all, this is not ketoacidosis. Ketoacidosis only occurs in type 1 diabetic patients or people with severe type 2 diabetes who burned out their beta cells in their pancreas. That's it. So what happens if you have normal blood sugars and you are not a type 1 diabetic or a severe type 2 diabetic, you will not go into ketoacidosis because you still make insulin and your blood sugar will not go so high that it triggers ketoacidosis. It won't happen. What we do is we put you in keto adaptation or nutritional ketosis, or what I call the keto zone. That is the sweet spot for burning fat. That is the key. And I have a whole chapter on this, debunking ketoacidosis, in my book, in the Keto Zone Diet book.
Myth number 2. Is the Keto Zone different from the Paleo diet?
Yes, it is. Now, Paleo is a good starting point. It is, but it's generally higher protein and higher carbs. And so when you do the Paleo, you do not get in the Keto Zone for the vast majority of patients. Now, again, for those lean athletes that need only about 75 grams of carbs into the keto zone, yes, they can, but for the vast majority, they can't enter the keto zone. So what the key difference is that those two things, too much protein and also generally the wrong kind of protein. The keto zone is healthy protein sources like pastured turkey, pastured chicken, grass-fed beef in moderation, not processed meat. Forget about the bacon and the sausage. Now, on occasion, you can have some in moderation. But again, we could take out the processed meats by and large because they're associated with causing cancer, the prostate cancer, the colon, which we have epidemics of these cancers in this country. Now, also, the key thing is the healthy fats. And a lot of these diets, especially Atkins says eat all the fats you want, good and bad.
Well, that's myth number 3.
Okay.
Is the Keto Zone just the Atkins diet regurgitated?
No, it's not. And I knew Dr. Robert Atkins. I used to see him at conferences back in the 90s. I talked to him and all at the conferences. When I have pictures with him back then, he was a famous doctor. But the Keto Zone is different in that Atkins, again, the protein is a high protein diet. And the proteins generally were from unhealthy sources, deep fried meats, as well as lots of red meat, lots of processed meats. And the fats, they'd eat slabs of cheese. They would eat all kinds of saturated fats, excessive amounts of butter, trans fats, deep fried foods, and things like that. This is a healthy Keto Zone program where we use healthy fats, healthy proteins, and lots of green, healthy carbs.
Myth number 4. The low-carb diet of the Keto Zone will make me tired.
Absolutely not. When you get in the Keto Zone, one of the key things it does, it turns the brain on. Because Keto Zone provides the essential fuel for the brain, which is ketone body. The brain actually prefers to burn ketones and fats rather than sugar. And it helps the brain think better, clearer, get rid of the brain fog, and also it turns down that appetite. So you get more mental clarity being in the Keto Zone. The problem is getting into the Keto Zone, and this is where the problem occurs. When you're in that transition phase between burning sugar, carbs or starches, and burning fat, you can develop the keto flu. The keto flu is when you're in that transition zone or that no man's land. You don't want to stay there because when that happens, the brain, it can't totally burn fat yet. It's not used to burning ketones or fat, and it's not burning enough sugar. So what happens when people enter that, my type 2 diabetes patients and my pre-diabetics enter into that keto flu where they get tired, brain fog, headache, and forgetfulness, and they lock their keys in their car. And so what I tell them to do is, it's the ketones. Gets them right out of that keto flu. Or if you cheat, and all of a sudden you get all this brain fog. A lot of people, especially women, they'll see a bagel or donut or cookies or brownies or Snickers bars, and they'll eat a bunch of it. And then all of a sudden they get the keto flu. And so they're in that transition phase. So once you're in the keto zone, boom, the brain is crystal clear. It feels really good. Now, if your sugar goes too low, yeah, you can get that foggy feeling. So, but once you enter the keto zone, your sugar's going to be a little lower. It's not going to be hypoglycemic, but you're just going to feel so much better with no appetite.
Okay, good information. Myth number 5, the keto zone is just too expensive. I can't afford it.
Keto zone is cheap because you're not eating that much protein. See, the highest cost food is usually steaks and, chicken and all these meats that we eat. Men are going to eat only between 3 and 6 ounces per meal of meat. Women 3 to 4 ounces per meal, or 2 or 3 eggs. And that's inexpensive. And then vegetables are cheap, and fat is real cheap. And don't go out and get soybean oil or corn oil or all these old polyunsaturated fats. They are not healthy fats. Get olive oil, extra virgin, organic, avocado oil, organic, as well as all these seeds and nuts. These are so healthy for you. My wife loves pumpkin seed. I've turned her on to pumpkin seeds, and she loves them. It's her favorite seed. But when you have these healthy fats, realize 70% of our diet is fat. When you eat fats, you're not hungry for hours. Some people 8-10 hours. And then you can practice what I call intermittent fasting. Then you reap tremendous benefits from the whole program.
Well, Dad, thank you for debunking the keto zone myths. And remember, keto zone's a lifestyle. Just take it one meal at a time. See you in the next video.
We'll see ya.